This video explains how the implantable telescope technology works and is not a full description of VisionCare's implantable miniature telescope by Dr. Isaac Lipschitz. For more information on the risks and benefits of this telescope implant, please read the patient information booklet at www.centrasight.com and discuss it with your doctor. The Centrasight Treatment Program utilizes implantable telescope technology, which can improve central vision lost to end-stage AMD, and helps you reconnect to things in life you love to see and do, and increase your independence and quality of life. As for most treatments, there are possible risks which you should consider before implantation. The healthy eye is comprised of several elements which work together to produce normal vision. Two of these elements, the lens in the front of the eye and the macula in the back, work to provide clear, sharp central vision. Light from a distant object first passes through the lens, which focuses the image onto light-sensing cells in the macula. The macula makes it possible to see well enough to recognize faces and colors, and to see objects in detail. Age-related macular degeneration, or AMD, is a disease of the macula which can lead to varying levels of impaired vision, from mild visual disturbance to central vision blindness. In the dry form of AMD, small yellow fatty deposits called drusen form on the back of the eye, or retina. This can advance to geographic atrophy, which results in a permanent degeneration of the macula with associated central vision loss. When this dry form of AMD progresses in this way in both eyes, it is referred to as end-stage AMD. The condition accounts for many new cases of legal blindness each year. Because it affects the macula, dry AMD causes impaired central vision, making it difficult to see things straight ahead clearly. However, peripheral or side vision is rarely affected by AMD. Dry AMD accounts for nearly 90% of all AMD cases. However, the condition can develop into the more rapidly progressing wet form of AMD. Wet AMD is caused by the growth of abnormal blood vessels which can result in scarring of the macula. When this occurs in both eyes, this is also an end-stage form of AMD. As a result, a patient's central vision loss can be permanent and severe. Unfortunately, at this time there is no way to repair the macula to reverse the effects of end-stage AMD. The central vision blind spot can significantly affect patients' ability to perform everyday activities and can severely decrease a patient's quality of life. The telescope implant from VisionCare can improve vision and quality of life for patients living with end-stage AMD. The implant has been demonstrated to help patients with end-stage AMD see better by magnifying images approximately 2.5 times on areas of the retina unaffected by AMD. The telescope implant, about the size of a pea, is implanted into the eye after removal of the natural lens. A viewed image enters through the telescope implant, where it is magnified and projected onto healthy areas of the retina. It is this area around the macula not affected by AMD that the telescope uses to help improve straight-ahead central vision. The telescope implant is virtually unnoticeable inside the eye. Patients wear standard eyeglasses to provide proper focus to see both close up and far away, and use natural eye movements to scan the environment. By way of magnification, the objects viewed are enlarged as shown here. The non-implanted eye is used to provide peripheral vision. In the Centrasight treatment program, patients learn to use one eye for peripheral vision and the eye with the telescope implant for central vision. Again, the macula itself is not repaired. The telescope implant cannot completely correct your vision loss, but it can help you see more with your central vision and improve your vision-related quality of life with the goal of reconnecting you with things in life you love to see and do. Individual patient results may vary. Normal vision is not fully restored with the telescope implant, but patients can regain central vision and vision-related quality of life by varying levels. Not every patient may benefit from the telescope implant, and it may be contraindicated in some individuals. Please consult with your ophthalmologist to understand the potential risks of the telescope implant used in the Centrosight treatment program to determine if it may be right for you, or refer to the patient information brochure at www.centrosight.com.